It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how mini dental implants will change your life.
I've had problems with my teeth.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
Kind of gave me my life back.
And it makes you feel good. It does.
I would recommend it to anyone.
Literally changed my life.
It's incredible. It is. It's absolutely incredible.
I'm John DeSciullo, and welcome to Innovations in Health. We're talking about the mini dental implant, a procedure that will change your life. And I'm joined by Dr. Rhett Eklund from Potomac Dental Center, a mini dental implant center of America. Dr. Rhett Eklund and his team at Potomac Dental Center are there for you. You can find them online at potomacdentalcenter.com. We welcome you, Dr. Rhett Eklund, to our program today.
Well, it's nice to be here, John. I would like to share with you this revolutionary way of being able to take dentures and to be able to attach it in what I like to say a non-surgical fashion into our patients' mouths. Traditional lower dentures, they're the worst. They don't stay in place. They move. You try to chew your food, John, and sometimes people say they're afraid they're even going to come out of their mouth. This approach has really changed the lives of my patients. We place 4 implants in the lower. Then we take a denture and we attach the denture onto the implants. You know that goo that they will put in their mouths, that adhesive?
Swallow it, it tastes terrible.
They don't need that goo anymore. They have something secure, something that can give them the confidence to live life on their terms, not what their denture will allow them to do.
And that lower sort of floats around on the gum.
Not anymore.
No, and that titanium post is what holds that into place.
The titanium post is something that I've been placing in my patients to secure their dentures since 2007. And John, I still see those patients today, and they're still able to enjoy the foods that they want to eat, not what they just think that they can eat. They're no longer having to hold back when they go out to eat.
That's why you can be you again with the mini dental implant. And speaking of food, you know, Dr. Eklund, we love all the foods here in Maryland, you know, from barbecue and our steaks and seafood, of course, and the crabs. All of that is now going to come back with a great taste sensation with the upper denture example.
I'm really glad that you mentioned that. As excited as I'm able to secure lower teeth on my patient, there's some very special things about what we can do with a upper denture. It's no longer needed to have that suction to hold the upper denture in place. We can hollow out the center part of the denture, and now their tongue has a place to fall into.
So that plastic that's removed from the upper, that's what's the suction to keep it in. Now that's gone, and your taste sensation is back.
I couldn't eat almost anything.
But with these, I can eat everything.
I can eat everything. It's unbelievable.
It was done, over, done. Let's go home and eat.
I have not had a problem.
I had dinner 45 minutes later,
I don't have any problem chewing anything.
and my teeth aren't falling out of my mouth.
And even more so is that discomfort of feeling like that you're always about ready to gag because you have that plastic, you know, sitting down deep into your throat. With the implants, we don't have to extend the denture back that far.
I want to talk a little bit about you before we get into our patients, because I think it's very important to note that here in Hagerstown, you're from this area. And talk to us a little bit about your background, where you went to school, and what motivated you to be a dentist.
We moved to Hagerstown in 1970. My father had graduated from University of Maryland Dental School, and I heard him say many times as we drove down South Mountain into Washington County, viewing Hagerstown, him saying that this is the promised land. And I love being a part of a family household where my dad was a dentist. It really offered a lot to me because he was able to pass on one very important part about understanding what it is to be a dentist, that it's really not about fixing teeth, it's about being there for patients' lives. My job isn't necessarily to just place the fillings and to give someone what they need so that they can eat and be healthy, but it's someone where they feel like that we can be a friend.
Well, you have a great empathy for your patients, and we'll hear about that in a minute. The phone number to call is on the screen, 301-683-8777, and online at potomacdentalcenter.com. Let's talk about some of the patients, and I know you have some photos and some great stories to tell.
It's really the whole purpose for us to be there for our patients. Our patients often they come out and seek us out. They're struggling with things in their lives. They're struggling with acceptance. They're looking for love. They're trying to not be judged. And some people have almost given up hope. And our place is to be able to find a solution that works for them. So coming up with a personalized plan, we're looking at something that's going to be the right choice for you. First, it's always health. What can we do so a person can not only have a nice smile, but first, what are we going to be able to do so that their life can be healthier? And if we don't give someone back posterior teeth, then they end up chewing on their front teeth, which causes extreme damage. First, we work with the back teeth. Same process again. We put in our very simply placed implants, and then in about 6 weeks, we take the impression, and a person's able to get a tooth that they can chew with that feels like that's their own.
If somebody does have a dental issue, they should not put it off. They really need to come and see you and your team.
So this is Crystal. Crystal came to our practice, and she had high blood pressure. Her A1C was 8+. She didn't feel good. She felt sick. But what brought her to our office was that she could no longer smile the way that she really wanted to be able to smile. And so Crystal didn't want to continue to go on the way that she had. But she'd been to other offices, and she was told that implants were not going to be possible for her. So she continued to put up with her teeth kind of slowly dissolving away. So we had a plan. We talked about some approaches with her. She decided to do an implant-supported denture. In her case, she wanted something fixed, something that wasn't going to fall out, something that would allow her to speak so it wouldn't gag like we have with this upper denture. So we did our surgery. Her teeth were removed, but the infection was also removed out of her mouth. She felt better, like the next day. This is after having all of her teeth extracted. And we hear this all the time. I can tell you now that Crystal's in a wonderful, loving relationship. She feels great about herself. She's now healthy again. And Crystal is now expecting, going to have a baby, which we were told was going to be impossible. But because that she's got herself healthy through taking the infection out of her mouth, it looks like that we're going to be able to celebrate a new life.
And I know the story of Beverly is the next.
Beverly, another just a sweetheart patient of ours. She was told that she couldn't have implants, that this was impossible. She didn't have enough bone. And we looked at her scan and we're like, Beverly, we can do this for you. You don't have to live with that denture that is causing you to be uncomfortable when you go out with friends and you're not able to really socialize or choose the foods that you want to be able to eat. So that's what we did. We placed implants, and now Beverly is able to enjoy a smile that she had lost, but even more than that, now she's able to socialize with friends and not worry about having to readjust her dentures that had gone loose because they didn't fit her anymore.
You can see the brightness in her smile, Dr. Eklund, just in the way that she's lit right up.
Once again, we talk with our patients and they tell us just amazing things. In her case, she told me how when she was 18 years old, she went on a date, and her date just turned and just stared at her to the point where she actually became a little uncomfortable. She's like, why are you staring at me? And he's like, you have such a beautiful smile, and that color looks so good on you. And she was like, felt wonderful. And so this color that you see right here of red now became her favorite color. But she lost her smile, and she could no longer bring herself to wear this color any longer. She came to our office after we had completed this part of her treatment, and I saw her wearing this very shirt. And I said, you know, that color looks really good on you. And she goes, this is the first time I've worn this color since I've lost my smile. And we were just like, this is incredible. You know, just giving someone their smile back can be so impactful. And you can see how she just radiates in joy.
And those are dentures that you worked with on her. So those implants secured those dentures and now have brought out that smile.
So Connie came into our office. Connie now had a professional job, but she found herself taking her hand and like placing it in front of her mouth so that people couldn't see that she had lost a tooth. And in her case, what she was doing, she was actually putting some wax in there. And she really did a magnificent job recreating a tooth with wax. But she couldn't really eat with it. It was good for when she would speak professionally, as long as she was at a distance. She didn't feel like that implants was something that she could afford, but she also knew where she was at work, she felt like it was holding her back. She came to our office in late November, and she's like, you know, this is my story. Is there anything that you can do? And one of my assistants, Penny, was like, not only can we help you, we can get you a tooth by Christmas. And so that sprung our whole office into action, from me getting the appointment together, working with the lab, calling the lab up on the phone saying, can we get a tooth produced by this time? Or rather, we have to get a tooth by this time because this is for Christmas. So before Christmas, Connie was able to come in, and this is her Christmas tooth that we were able to give her. No longer was she needing to use something that she was creating herself. And she tells me that she has a lot more confidence and just a lot of appreciation that we did that extra effort for her. Once again, this is something that our patients love to share their stories on social media. John, I don't know if you find it interesting ever to look at social media, but maybe you would like to take a look at what we do at our office.
Well, you know, I am on my phone quite often, and I am a big fan of Facebook and Instagram, and I know that you have an amazing social media platform. So I guess, you know what, folks, if you have a cell phone at home, a mobile device, an iPad, or even your computer, you can do what I'm about to do, and that's call up Potomac Dental Center on Facebook or on Instagram, and you can not only connect with Dr. Eklund, you can hear all the great stories of these people whose lives have been changed. We should mention, Dr. Eklund, that, you know, the mini dental implant procedure, we talk about the fact that it's so much less pain and discomfort. You really are looking at maybe an over-the-counter medication on the day of the procedure. Am I correct?
Absolutely. We have our patients take Tylenol. We'll have our patients take some ibuprofen. This is not a type of surgery in which there's an extensive grafting that's being done, something that's going to be, you know, just really hurting our patients. Also, all of our patients, they leave our office with attached teeth. We do not design cases where someone's going to have to wear something removable in their mouth and go up to a year and maybe longer before getting their teeth. For my patients, that's not acceptable. And so we found a better way where we could give someone back their smile much quicker.
Dr. Eklund, the mini dental implant, when it's placed, how do you take care of it when you send the patient home?
You brush it, you floss it, you use a water pick, just all the normal things that anyone else would do with their teeth.
That's an amazing thing, and the procedure is done right in office at 1301 Potomac Avenue. It's the Potomac Dental Center, a mini dental implant center of America in Hagerstown, right up the I-81 corridor, everybody. Everybody knows it. Call 301-683-8777. That's the number to call, and online at potomacdentalcenter.com. Center spelled C-E-N-T-R-E.
Sandra is just a sweetheart of a person. We gear up our day knowing that patients are coming in and they're depending upon us to be able to give them their confidence that they may be lacking back. Like so many of you that are watching this show right now, you've put other people first, and that's what Sandra had done. She had put other people first, And now she gotten to the point in her life that she had lost her smile, and she came to us because she's watching her grandson and wanting her grandson to have good teeth, and the grandson would turn and look at her and be like, Granny, your teeth aren't good. Why do I need to brush mine? And so she decided to have not dentures, but fixed teeth. She didn't want to be in that situation where she would have to explain something to her grandson that these aren't real. She wanted something that would feel real to her. And social media is a big part of what we do in our practice. And as we'll go through our procedures with patients, our patients are generous enough to post this information. And soon we'll have a person so that they feel confident in themselves again. After surgery, the very next day, most of our patients are feeling great, and I'm going to show you some examples soon of how good that they look, even one day after surgery. So here's Sandra now. Sandra feels confident that she's still watching her 3-year-old grandson, and she came into our office with this new smile, watching her 3-year-old grandson for just a normal check. The grandson turned to my assistant and said, "Thank you so much for giving Granny's smile back." And Sandra really felt like that she knew she did exactly what she needed to do, that her grandson would be able to use that experience so that he would take care of his teeth.
What a terrific story. And we should make mention that how you were able to help Sandra is through a mini dental implant. Show us the plan that you struck for Sandra.
We talked about implant-supported dentures, something that would snap on and off, but that still might put her in that situation where her grandson would feel like that she really didn't have teeth. And so in her case, what we decided to do is to put more implants in, and instead of having plastic teeth, we were able to make porcelain teeth that, in this case, we cemented on permanently. So this feels like her teeth. It's not something that comes out. She brushes them, she uses a water pick, and she comes into her dental appointments like anyone else with attached teeth.
And is that the permanent solution then, Dr. Eklund, that those teeth are cemented in?
This is cemented in permanently. They're attached just like your natural teeth are attached to your bone.
So if God gave us our baby teeth and our adult teeth, you're giving, what you did with Sandra, a third set of teeth with what we call the roundhouse, and it could be an upper or lower or both.
Correct. Beau is another example of someone that had lost his confidence. Beau had been there for his wife, and his wife slowly faded away, and she passed away from cancer. So Beau came to us, and he talked about this challenge that he was facing. He wanted to go out and meet people, but he didn't want to be judged for the way that his smile looked. And so we went through his options also. And he chose to have fixed teeth once again. Beau's an active guy, he plays a lot of tennis, and he didn't want to have a denture that possibly could slow him down. So here's Beau now. Beau now has regained his smile and regained his confidence. He feels good about meeting people, going out to eat. And one of my favorite stories that Beau told me, I mentioned before how he likes to play tennis. Well, he said now that he has this big smile, when before he would hide his mouth, now he would grin. So when he would do that really good passing shot, his opponent would have to look up and see this big grinning white smile. And they would even say, when they would go to bed at nighttime, they could still see Beau there smiling, and it kind of haunted them. But Beau loved it because he knew he was back out there doing the things that he loved once again.
The mini dental implant, folks, is something, whether you are a little bit older, you shouldn't hold back in trying to secure this, because you need to get your life back, whether it's enjoying food, whether it's working and enjoying with your family and your friends, and enjoying the food that we love. And you don't need to hold back. Why do people, do you think, Dr. Eklund, hold back in doing this, knowing that this is available to them?
Well, like in Beau's case, I think that the scars of life just kind of beat you down, and you feel like that things are now hopeless. And even when it comes to something that a lot of us take for granted, like a smile, they feel like that they can never regain that. And this challenge becomes something that they either have to rise up and meet, or not do anything about it and just kind of say, this is just the way my life's going to be. And age isn't a big factor. I've done procedures like this with patients in their 90s. Bone is something that we can use, and it's not something that's just available if you're in your 30s, 40s, or 50s. But these are the type of things that many of my older patients really gain satisfaction to be able to eat and laugh with family as they go into those golden years of life.
Before we get into some more stories, I know that you make this an affordable option for the folks that come to the Potomac Dental Center. And if you go to the website, potomacdentalcenter.com, you'll see some of those options, because that's important too. You want to make this work for the patient.
When a patient comes in and we do our consult, we're looking for something that's going to work for that patient. And so I don't really start out with a preconceived idea that this is what that patient needs. The patient will just sit and start talking to us about something in their life. I don't sit down, my team doesn't take x-rays and look in their mouth and start figuring out what they need. We'll listen to their story, and then from what they're sharing with us, we'll be able to come up with possible solutions. And we just don't look at one solution. We'll bring up 4 or 5 different options with the patient to see what's going to fit with them best. And the great thing about all of this is that everything that I do is upgradable. We can start small. We can maybe extract a tooth. We can place an implant. We can place more implants. We can give someone a denture. We can give someone fixed teeth. And sometimes this needs to be stretched out over years. But we do offer financing in our office, which most of our patients end up taking advantage of. And this is a way so a patient who has the ability with credit can immediately get what they want and not have to wait those 4 or 5 years to get to the place that they're really looking to go.
Sure, and it's great that you work with the patient on that, because most of us will pay a mortgage on our home or pay for our car on time, and this is an investment in yourself, and it should be something that you do. Let's talk about another patient, Dr. Rhett Eklund.
Another, just wonderful patient of ours, Tina came in. Tina also was there for her family members. She lost her smile. A disease had set into her mouth, but she was scared. So scared. And the idea of coming and having a dentist do anything just brought back horror things in her mind. Our office, we're an IV certified sedation office, and that was exactly the right solution for Tina. Tina would not have been able to have done this without the sedation. Matter of fact, Tina didn't even wanted to know when her appointment was going to be. We had to talk only with her husband because it would just, make her a nervous wreck, realizing that she was getting closer and closer to her surgery date.
If anyone out there is as terrified of going to the dentist and has that fear, go see Dr. Rhett and all the wonderful staff. Let him put you at ease like he did for me.
Many of our patients are very anxious. They can't bring themselves to go to a dentist. That's where sedation dentistry is the answer. Call to schedule today. So once again, social media was a big part of her experience. Also, she would post how her life had been changed, and even as it was going on. I think in this sense we were using a TikTok. I think right here we're back to an Instagram, and she's stating here, "Thank you, Potomac Dental Center. Have no words to express my feelings and giving me back my smile." So here's now Tina's final. Tina's able to eat the food that she really wants to be able to eat again. She feels really confident in herself, and we're so happy that we could be a part of that journey with her.
And I know Tina is a working mom, and we talked a little bit about Tina's story beforehand. It's quite a journey for a mom, let alone a working mom, and you have really brought back a sense of confidence to her life.
No one works harder than a working mom. You know, my office is mostly ladies, and you know, they work hard, give it everything they got at work, and what do they do when they go home? They just go right into taking care of dinner, meals, home. It's just amazing what they do. So we had now completed Tina's case. And we spoke before about her having a loving family that she'd really given a lot to. And this was just a wonderful celebration in our office. Her family was there present. They brought in champagne. This was on the day that we gave her fixed teeth. We had confetti that was going off. And I tell you, it's a good day in my office and when it's all messy with confetti all over the floor. I know that we've done what we needed to do to help someone regain their life back again.
So you celebrate the patient with your team at Potomac Dental Center. That's terrific.
Our whole office had invested in that.
The Mini Dental Implant Center of America at 1301 Potomac Avenue in Hagerstown. Phone number is 301-683-8777. And the mini dental implant, we should mention, everybody, is 5 times less. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. Dr. Eklund, I don't know if I've ever met a medical expert who is so empathetic for their patient, and it's really inspiring. Is that what motivated you, in addition to the influence from your father, to be a dentist?
I guess my motivation comes to make the world a better place. I know it sounds kind of trite, but to place a filling might be helpful for a person, but we wanted to be able to do more impactful things. And my team, it really inspires them to be given that opportunity, that privilege to work with people that feel like that there is no one else that will listen to them, that work with people with understanding that we don't judge them by the way that they look right now, because we know what that we can become, that we'll treat them as an individual and not just a cookie cutter plan that we just give to every one of our patients, but that find something that's going to be affordable and perfect for them. So that's why this makes us inspiring, because we know the outcome of how a person can regain their life that they may have thought once was lost.
Well, congratulations on everything that you and your team are doing in Hagerstown, Maryland. You are an innovator in health. Thank you. Thank you for joining us, and thank you for watching.